All right, well, hello everyone again. Nice to see you all here today. For those of you attending in person, we need to apologize. Westwood had a power outage yesterday and our system is down as a result. So you're going to be able to see the slides on this screen. Normally we'd have them on the other screens. It will be fixed by our next seminar. Anyway, my name is Gwen Driscoll. I'm the Director of Communications here at the UCLA Center for Health Policy Research. It is my pleasure to welcome you once again to our 2015 Health Policy Seminar Series. We will be recording today's seminar and it will be placed on our website at the address you see at the top of this slide. In terms of our ongoing health policy seminar series, if you want to find out what's coming up, and we've got some really exciting stuff coming up, please subscribe to our e-newsletter, Health Policy News. We have over 13,000 subscribers in California and across the country. It's a pretty popular way to find out about the latest trends, data, and research from the center and on health policy in general. So please subscribe. In terms of today's seminar, we will be having our speakers speak. Feel free to ask questions if there's something urgent that pertains to what our speakers are talking about, but in general, we ask you to hold your non-essential questions to the end. We will have like a 15-minute Q&A at the very end. We will be announcing the topic and date of our August seminar shortly, but I will give you a hint. It will be on all the new innovations and features of our upcoming CHIS 2013-2014 data release. So please sign up and stay tuned. All right, I am now very happy to introduce Doctors Joelle Wolstein and Dr. Susan Babey, the co-presenters of today's seminar, and two of the three authors, along with Dr. Alison Diamant, of the center's recently report, Obesity in California. That report looks at 10 years of CHIS data on obesity and overweight and estimates that 1/4 of Californian adults were obese in 2012, compared to less than 20% 10 years ago. Obesity rates are also significantly higher amongst low-income Californians and among Pacific Islanders, American Indians, African Americans, and Latinos. For those of you here in person with us, there is an executive summary printed out. It should be right in front of you on your desk. For those of you joining us online, you can see the full report on our website at healthpolicy.ucla.edu. Our URL is also right over here at the bottom of the slide on the right. So in terms of our speakers, both Joelle and Sue have followed this issue for many years. Susan is the co-director of the center's chronic disease program and a senior research scientist here at the center. She's also the lead author of numerous high-profile studies on the issues surrounding obesity and linked to obesity, including research that has conclusively linked soda and obesity, park access and physical activity, as well as fast food restaurants and poor dietary habits, especially in low-income neighborhoods. Joelle recently received her PhD in health services from the UCLA Fielding School of Public Health and wrote her dissertation on different aspects of the food environment, with a focus on farmers markets. She has previously worked for both the National Cancer Institute and the City of Los Angeles on projects aimed at improving diet, especially amongst poor or vulnerable populations. Their past and current research make them ideally qualified to talk about today's topic, which is the structural and environmental factors playing into California's growing obesity rates. Without further ado, it's my pleasure to introduce Dr. Joelle Wolstein and Dr. Susan Babey.
Thank you. As Gwen said, I'm Joelle Wolstein and this is Sue Babey. And today we'll be talking to you about the environmental factors associated with rising obesity in California. How do I go to the next?
Click on the arrow bottom.
Great. So first I want to give you a quick overview about what we'll be discussing. We'll give you some background on obesity, and then we'll discuss obesity prevalence and trends, including income and racial ethnic disparities. And then we'll discuss some other factors associated with obesity, including health behaviors and neighborhood conditions, and we'll conclude with some recommendations. So many of you are probably familiar with the health risks associated with obesity. Obesity has been found to increase the risk of type 2 diabetes, certain cancers, heart disease, and stroke. And in 2008, the CDC estimated that obesity in the US cost approximately $147 billion. And in 2011-12, N. Haynes found that approximately 35% of US adults were obese. This chart displays trends in obesity from the 1960s to around 2008. And in the 1960s and 70s, around 15% of the adult population was obese, and around 2000, more than 30% of the adult population was obese. Now, the latest data shows that this has increased to 35% in 2008, but the good news is that rates have stopped increasing significantly since around 2003. For our study, we used California Health Interview Survey data, which interviewed over 47,000 households in 2011 and 12, and the interviews were performed in all counties of the state in 5 languages: English, Spanish, Korean, Chinese, and Vietnamese. And the weighted survey data are representative of the California population, and the survey asked questions on health status, health behaviors, and demographic and social characteristics. Now, for the findings of our study. This chart displays the changes in the proportion of adults in different weight status categories based on BMI. So you can see that in 2001, around 19% of the adult population was obese, and in 2011-12, almost 25% was obese. This chart shows the relationship between obesity and income as a function of the federal poverty level. Adults living below 200% of the federal poverty level had a higher prevalence of obesity than their higher income counterparts, so 30.5% compared to 20.2%. And though we don't display it here, overweight and obesity was nearly twice as high for low-income teenagers compared to higher income teens. This graph shows the relationship between obesity and race ethnicity. The prevalence of obesity was higher among African Americans, Latinos, and American Indians than whites, and it was lower among Asians than whites. And as you can see, all racial ethnic groups experienced an increase between 2001 and 2011 and 12, but they were only statistically significant amongst Latinos, whites, African Americans, and Asians. This next graph shows also the relationship between overweight and obesity and race ethnicity, but among teens. Overweight and obesity was higher among African Americans, Latinos, and those who identified with multiple races compared to whites. And white teens had the lowest prevalence of obesity and were also the only group who experienced a change since 2001, and it was actually a decrease. Okay, so we also examined the relationship between dietary behaviors and obesity. And existing research has found that fast food and sugar-sweetened beverage consumption is linked to increased caloric intake, lower diet quality, and weight gain. And on the contrary, higher levels of fruit and vegetable consumption is linked to reduced risk of health conditions like diabetes, obesity, cancer, and cardiovascular disease. So in examining how dietary behavior was related to obesity, our data had similar findings. We looked at consumption of soda 1 or more times per day, fast food consumption 2 or more times per week, and fruit and vegetable consumption 3 or more times per day, and found that obesity was higher among adults who had less healthy dietary behaviors. So we also examined the same relationships between obesity and dietary behaviors after controlling for demographic factors, physical activity, affordability of fresh produce, and neighborhood safety and cohesion, and we found that the relationships remain the same. So now I'm going to turn it over to Sue, who will tell you about the relationship with physical activity and also some neighborhood conditions.
Thank you, Joelle. Okay. So, physical activity is associated with the prevention of obesity and chronic conditions like diabetes, heart disease, osteoporosis, some types of cancer, and it's also been linked with premature death, a lack of physical activity, I should say. And although there are a number of ways that adults can be physically active, walking is the most common form of physical activity among adults and does provide significant health benefits. So we looked at the relationship between physical activity and obesity, specifically walking, and two types of walking. Walking for transportation, which is walking specifically to get from one place to someplace else, or walking for leisure, which is just walking because you felt like going for a walk. And in both cases, we found that walking was related to lower levels of obesity. Adults who walked for transportation or leisure were less likely to be obese than adults who reported not walking. We also looked at this relationship between physical activity and overweight and obesity among adolescents. So similarly with adults, regular physical activity is important for youth to maintain health, prevent obesity, and help develop healthy behaviors throughout their lifetime. The U.S. Department of Health and Human Services recommends that youth get at least 60 minutes of physical activity every day. However, few adolescents actually meet these guidelines. In California, only 18% of adolescents achieved this recommended level of physical activity in 2011 and 12. And in looking at the relationship between physical activity and overweight and obesity among teens, we found that 40% of adolescents who did not get 60 minutes of physical activity on any day were obese, compared to just 29% who were physically active on at least 5 days per week. Now, earlier, Joelle discussed the relationship between eating more fruits and vegetables and obesity. However, people are unlikely to buy and eat fresh produce if they can't afford it, even if it's readily available. In California, less than half of adults reported that they had affordable fresh produce in their neighborhoods, and 21% reported that it was never or only sometimes affordable. In looking at the relationship between affordability of produce in neighborhoods and obesity among adults, we found that adults who reported fruits and vegetables were never available or never affordable or only sometimes affordable had higher rates of obesity compared to those who reported always having affordable fresh produce in their neighborhoods. The extent to which people feel safe in their neighborhoods can also impact our health in a number of ways. For example, lack of safety can deter physical activity and increase levels of stress. In California, less than half of adults reported that they always felt safe in their neighborhoods, and 13% reported that they never felt safe or they felt safe just some of the time. These perceptions of neighborhood safety are related to obesity. Specifically, we found that 30% of adults who felt unsafe in their neighborhoods were obese, compared to less than 1/4 of those who felt safe all of the time. We also looked at how neighborhood safety impacts overweight and obesity among youth, and we found that 30% of teens who reported that their neighborhood was safe were overweight or obese, compared with 40% of those who reported that their neighborhood was not safe. In addition, research suggests that neighborhood social conditions can impact health, and social cohesion is one of these neighborhood factors, which is an indicator of connectedness and trust among neighbors. It's measured by the extent to which people are willing to help others, share values, get along with, and trust their neighbors. We looked at the relationship between adults' reports of how cohesive they felt their neighborhoods were and overweight and obesity. And we found that the prevalence of obesity was higher among adults who reported lower social cohesion than it was among adults who reported higher social cohesion. We also looked at another aspect of safety, which is feeling whether your neighborhood parks are safe. So parks provide important opportunities for youth to engage in physical activity, and they've been found to be associated with more active lifestyles. Characteristics of parks, including whether you think the park is safe, can influence whether people use the parks, and in turn, whether people are able to be active in the parks. We found that perceptions of park safety were related to overweight and obesity among teens. Specifically, we saw that more than 40% of teens who felt their neighborhood park was unsafe were overweight or obese, compared to just 27% of those who reported that they strongly agreed their park was safe. Now, this slide summarizes the associations between the neighborhood factors and obesity that we looked at among adults. It displays odds ratios for the neighborhood factors we discussed based on regression models that adjust for age, gender, race, income, physical activity, and dietary behaviors. What these graphs are showing basically is that adults are more likely to be obese when fresh fruits and vegetables in their neighborhood are not affordable, when they feel unsafe in their neighborhood, and when they perceive less social cohesion in their neighborhood, even controlling for those other demographic and health behaviors that I talked about. So, to summarize, nearly 18 million California adults and adolescents were overweight or obese in 2011-12. Unlike the national trends, obesity rates among adults went up between 2001 and 2011-12, whereas nationally they've seen no significant increases in adult obesity since about 2003. However, our data are similar to the national data in terms of the adolescents who have not had significant increases in overweight and obesity since 2001. We found that obesity was related to diet and physical activity. So obesity rates are higher among those who consume more soda, more fast food, and fewer fruits and vegetables. Rates are also higher among those who are less physically active. But neighborhoods influence what people eat and how active they are. And we found several neighborhood factors that were related to obesity, including unaffordable produce, low social cohesion, feeling unsafe in your neighborhood, and feeling that neighborhood parks were not safe. We also saw significant disparities in obesity as a function of income and race, specifically with higher rates among low-income Californians, as well as Latinos, African Americans, and American Indians. These differences are related to disparities in diet and physical activity, which in turn are influenced by inequities in access to safe and healthy environments, like neighborhoods with safe parks and affordable produce. So, sorry, I talked about all the conclusions, but forgot to move the slide forward. So now I'd like to turn it back over to Joelle, who is going to discuss some of our recommendations.
Okay, so I'm going to tell you a little bit about our recommendations for decreasing the obesity issue in California. And our first recommendation is to increase access and affordability of fresh produce. So one way to do this is to increase the presence of farmers markets, food co-ops, and community gardens in underserved areas. Currently, SNAP, which was formerly known as the Food Stamp Program, and WIC SSNP, or the Special Supplemental Nutrition Program for Women, Infants, and Children, try saying that 3 times fast, provides vouchers to beneficiaries for purchasing fresh produce at farmers markets. However, not all farmers markets in the state accept these vouchers. So our recommendation would be to promote the acceptance of these vouchers at all farmers markets to make fruits and vegetables more affordable for beneficiaries. Our second recommendation is to improve park availability and park safety. Local governments should consider undertaking projects to improve the perceived and actual safety of parks. Policymakers can work with community members and the Departments of Parks and Recreation to determine appropriate strategies for doing so. And also reducing dark areas in parks, perhaps by improving lighting and making spaces more open, can potentially prevent crime and increase feelings of safety amongst neighborhood residents and park users. Our third recommendation is to improve neighborhood safety. If people feel safe in their neighborhoods, they're more likely to engage in outdoor physical activity. So community leaders and local governments can develop neighborhood crime and prevention programs, which government agencies should support by providing information on how to create and sustain these programs. And the hope of doing so is to increase activities like leisure time walking outdoors in the neighborhood or playing outdoors and feeling safe while doing so. Our final recommendation is to increase neighborhood social cohesion. Leaders and local governments can help build opportunities for residents to interact with one another. And one way to do this is to increase the walkability of neighborhoods. Some ways of doing so are to encourage mixed-use development, the availability of spaces for recreation, and pedestrian-oriented communities. So we would like to thank Pan Wang for her statistical support, and we would also like to thank the California Endowment for funding this research. Thank you very much. This report, as Gwen mentioned, is available at healthpolicy.ucla.edu, and our contact information is below. Thank you.
Is there any questions?
Yeah.
This one, quick one. In your paper, you define what you mean by physical activity. You said 60 minutes a day was undesirable, and 18% of Californians do it, or teens.
Yeah, so the question was, in our study, did we define physical activity? I'm repeating it for the folks who aren't in the room. Yes, we did define physical activity, and it's based on how the data was collected in the survey. So adults were simply asked about walking for transportation or leisure, and for that variable, we just looked at whether they reported any walking for transportation or leisure that was at least 10 minutes long. For the adolescents were asked whether, on how many days in the past week they were active for at least 60 minutes. And so they had to guess, well, on Monday, no, on Tuesday, yes. But this measure has actually been validated against objective measures of physical activity and is fairly reliable, although not as good as objective measures. Yeah, Shayna.
Actually, I'm going to go back and forth.
Oh, sure.
So we have a question. We have a question about the adverse effects of medication that causes. Does anyone consider the adverse effects of medication that causes obesity by causing metabolic diseases as a side effect of medication? I know you didn't look at that in your report, but can you speak generally about whether that's an issue in rising obesity rates?
Well, as you mentioned, we didn't look at that in our study, but metabolic syndrome is one of the risk factors, and obesity is one characteristic of metabolic syndrome, and it's a risk factor for a number of chronic health conditions and cardiovascular disease specifically. So any medications that contributed to that, I think, could potentially be problematic, but I can't speak specifically to what those medications are or what you might do about that other than work with your doctor to come up with a plan that works for you.
So this is the first time I've seen all this in one place, and I have to do a report. So it was really interesting to see how all of the factors that you would expect, this unsafe neighborhoods and all those things, individually held up even with the multi-regression models. So I'm not sure if you've already looked at this. This might be something to look at in the future. But did you look at any interactions of putting unsafe foods interacting with, unsafe neighborhoods interacting with less availability of fresh food and all of those things that came up with significant, maybe having some kind of compounding factors, whereas if you had just one of those, you might not have as high risk if you had maybe all 6 together, that kind of thing.
We didn't look at that in this study, but that's definitely something we could look into in the future.
Yeah, and I think it's a really good question, and it's something that we would definitely be interested in looking at.
Could you repeat the question?
Oh, sorry, we didn't restate the question. The question was, did we look at how these neighborhood factors relate to each other and whether they interact with each other in the multivariate models that we conducted? And yeah, so we didn't look at that, but I think it's a great suggestion, and it's something that would definitely be interesting to look at in the future.
Online question. Farmers markets are a good idea, but produce there can be expensive. Has the policy world looked at that, how to bring prices down there?
I think actually one of the reasons that farmers markets are promoted as a good source for fresh fruit. Oh, sorry. The question was about the price of fresh produce at farmers markets, that sometimes it can be expensive, and if policymakers have looked into that. The thought actually is that farmers markets cut out the intermediary and they bring produce from the farmer directly to the consumer without going through a grocery store or another vendor. So they should actually be lowering costs, but fruits and vegetables unfortunately are very expensive. The only policies I'm aware of are the vouchers through SNAP and WIC to decrease the cost of fresh fruits and vegetables for beneficiaries.
Yeah, just had an interesting thought. I liked a lot of the information you brought up, and I thought what was interesting was, in particular, the incomes. Like the higher income people tend to have lower obesity rates. And one thought I had was like gym memberships. So like people who have higher income tend to maybe be able to afford gym memberships in certain places. And I felt, especially like in Los Angeles, right, there could be that sort of extra project there where you just like look at gym facilities in like different areas and see the price of them and whether people can afford it or not.
Yeah, so the question it was more of a comment actually than a question about low-income Californians having lower rates of obesity and whether that might be related to their extra resources being used for things like gym memberships, which not everyone can afford. And there was a suggestion to possibly look at costs of gym memberships and availability of those kinds of facilities for physical activity. And yeah, that's something that we haven't looked at specifically, but I think it's a good hypothesis. Thanks.
Just going to go online again. One attendee wants to know, are these data on obesity available at a smaller local level, e.g. city or zip code, via AskChissAny or another source?
Yeah, the data are available by the question was if the data are available at smaller levels than the state, and they are available at the county level and also county group level, which is slightly larger than the county level, and they're available by SPA for LA County. And
yeah, so and the data by county are in our report. They're also available through AskChiss, but through AskChissAny, adult obesity rates and adolescent overweight and obesity rates, I believe, are available at city, zip code, and legislative district. Pan's nodding her head, so yes, that's correct.
Could you just tell folks what AskChissAny is?
Oh yeah, so AskChissAny is AskChiss Neighborhood Edition, which provides a select number of indicators that are available through CHIS and a couple other data sources at smaller levels of geography, so city, zip code, and legislative district. Yes.
I tend to think that eating healthy is based on psychology and motivation.
Mm-hmm.
I know your study wasn't that, but I wonder also, is there a difference in perception between the various groups? So that if you asked a Caucasian, you know, who's thin or whatever like that, compared to one people of color or whatever else you said. Has anyone done any work with more the psychology, the motivation, perception?
Okay. So the question was about whether anyone has done work looking at whether psychology and motivation are related to the dietary behaviors like the ones that
And
we looked at,
perception
and perception of,
various, like, Latino
oh,
communities,
perceptions of the different groups.
African- yeah.
Okay, perceptions of different racial and ethnic groups. So I'm not familiar with that area of research. I know people have looked at cultural differences in food preferences, and also I'm guessing that there are probably some motivation and other sort of psychological differences that are related to those cultural differences. But off the top of my head, I can't I'm sure there's work on that area, but I'm just not that familiar with it. Mm-hmm.
Question from online participant: did the survey distinguish between diet soda and regular soda intake, or diet sugar sweeteners?
Actually, the question was if the survey distinguished between diet soda consumption and regular soda consumption, and actually, in the question they specifically excluded diet soda consumption. So this was strictly sugar sweetened beverages.
We had a ton of online questions. I'm gonna just take a few more. Are there major differences or similarities in the findings as compared to the recently released LA County Health Needs Assessment and potential opportunities for partnerships with CBOs, et cetera?
Well, so the question was if there are similarities and differences between the recently released LA County health assessments and opportunities for partnering with CBOs. I haven't looked at that yet, so I can't speak to how similar or different the findings are. But in terms of partnering with CBOs, I mean, we typically work to provide data that can be used by CBOs, and if there's data that community-based groups would like but don't have or don't know how to get, we're happy to help them try and find that information. But we're not an advocacy organization per se, we're a research organization. So I don't know if that answers the question. Did you want to add anything?
I think you covered it.
Okay.
Were there any objective evidence, like police reports confirming park safety? I believe you talked about how the survey reports that information.
The question was if there were any police reports or
other objective verification of the perceptions of safety. So no, the data is all perceptions of safety, both in terms of neighborhood safety and park safety. So it's whether people feel safe. And it's an interesting question because the distinction between objective measures of safety and perceived safety isn't one-to-one. So in a lot of cases, the objective crime data might show an area isn't that safe, but people feel fine, or conversely, an area has very little crime, but people still don't feel safe. And so there's a whole separate field of research that looks at what drives perceptions of safety, and only part of it is actual objective crime.
Is there any other question for her? We have a question. I want to make sure I'm understanding it properly. It's more of a comment, I think. What about creating partnerships with local organizations to support, I believe she needs to support farmers to increase the availability and access of fresh products to the local community as part of the local food system approach?
So the question was, or comment was, what about establishing partnerships with farmers to promote providing access to their produce? Do you think that's accurate?
I think so.
Yeah. So I think there are organizations that are working to partner with farmers through like CSAs or community supported agriculture. I know that WIC has looked into whether it can help facilitate WIC recipients receiving produce through community supported agriculture. So I think there are some opportunities there, but it may require a little bit of imagination to sort of figure out how to make those things work, particularly with more bureaucratic programs like SNAP and WIC. Yeah, Nadi.
I was just thinking about what you were talking about, the availability of, affordable or just availability of fresh fruit and produce. And one of your recommendations was about community gardens, which is a fantastic idea, and yet by the same way that you say people don't have access even to, theoretically you can convert your backyard or your front garden, instead of having grass, which you're not supposed to, you could have fresh fruit and vegetables. And I guess I'm not necessarily asking you a question. I want to hear your thoughts about the feasibility. How much would that really contribute? On one hand, it puts you in touch with the reality of food production, and once you realize that fresh fruit and vegetables taste very good, you sort of might be motivated to do more, but not everybody has access. Just what do you think about that as a viable approach?
So the question was about our thoughts on the viability of community gardens as an approach, and what kinds of issues might be involved in that as a way of increasing access to fruits and vegetables.
I think there's a wonderful opportunity to create partnerships between the community and schools who have more space than individuals might, or perhaps with the Department of Parks and Recreation to also take advantage of the space that they may have. And I know there are studies showing that young children learn to appreciate the flavors of fresh produce when they grow it themselves, and also the time it takes to produce fresh fruits and vegetables. So I think for children it could be a wonderful opportunity to even get excited about consuming fresh produce, which might not be as appealing as a hamburger to them right now. And I think working with the community might give people a lot more access, as I mentioned before.
Yeah, so I think I agree that the school gardens are a great opportunity. I know that some schools have run into complications if they've actually wanted to try and use the produce from their gardens to feed the students, in terms of not having enough of any one thing available to actually offer it during meal times, or maybe not being allowed to use it in the cafeteria. But the experience that the kids get from working in the garden, I think, is valuable, and it also makes them more interested in eating the fruits and vegetables that come from the garden, so it has that added benefit. In terms of the community gardens outside of schools, I think there are definitely access issues. So, some communities don't have any community gardens at all, but and then some communities have gardens, but not nearly enough to meet the demand for them. And then I think even if they have community gardens and people can get a garden who want one, then I think there may be some people who are not as able to take advantage of it because they lack resources like time to spend in the garden. So some low-income Californians may not have the same ability to take advantage of those, even if they are available.
I work in this area, school gardens and community gardens, etc. And there's a lot of things happening in LA. It's like there's an ordinance that just came down that people who have vacant lots, their property taxes can be forgiven if a community wants to use that vacant lot for a garden. There is something in the LAUSD that says the food from the garden can go into the cafeteria.
Oh, great.
And in Riverside School District, they're doing that right now. They actually buy it from the school, so that goes into the garden again and so forth. So do you see, and of course in Inglewood there's the whole Social Justice Institute where their goal is to create 1,000 residential gardens, and a graduate of the School of Education here is heading that up. Do you see the center as providing any of this information about what is going on? I don't know that there's one repository, to let people know that there are great things, afoot.
Yeah.
Yeah.
So there were a few, I don't know how much you wanted me to try and repeat back. There were a few comments about, because Marianne works in this area of school gardens, and so there are a lot of things happening in terms of, let me see if I can remember them, LAUSD saying that food from the gardens can be used in the cafeteria, an LA ordinance for giving property taxes for people who let people use vacant lots for community gardens. Forgiving property tax.
Mm-hmm.
Okay, on vacant lots that are used for community gardens. There were more things.
Well, just the Inglewood project.
Oh yes, and then a social justice project in Inglewood trying to increase the number of residential gardens. And then the question was whether the center can help provide information around this issue, because there's not a single repository of information about what's happening around this issue. And I think that's potentially a role we could play. It would require gathering the information, but yeah, I think that would be a really interesting project.
And I think we would welcome the opportunity to look into it further.
Yeah.
Sue and Joe, can you talk about what's happening in rural areas and what could be done about it, given the relatively small population sizes in rural areas and the financial lack of feasibility to build miles and miles and miles of sidewalks, for example, in rural areas?
So the question was about what's happening in rural areas. And in the report, we didn't look specifically at whether there were differences in obesity in rural and urban areas, but rural and urban areas are obviously different in a number of ways in terms of their built environment, in terms of the population density. So the ways that rural and urban areas need to address health issues like obesity are going to be different. And Gwen alluded to, for example, it being perhaps not the best use of resources to build a lot of sidewalks in rural areas where, people probably aren't walking down the street that much if, there's only one house there and there's nothing to walk to. But I'm not exactly sure what I would recommend. I don't know if you had any thoughts.
Yeah, again, we didn't look into this specifically in the report.
Let me put you on the spot in a different question, which is,
Okay.
what do you think about ongoing efforts to levy a soda tax in California and elsewhere?
All right, so the question was what we think about ongoing efforts to levy a soda tax in California and elsewhere. So there's a lot of evidence that suggests that consumption of sugar-sweetened beverages is bad for our health, and if we could reduce the amount of sugar-sweetened beverages that we drink, it would be good for us. There's research suggesting that if you tax things like tobacco products and potentially soda, then sales go down and presumably consumption would go down. I think at this point there's still some debate about how high the tax would need to be to actually have an impact, but the research suggests that that would be one effective policy for reducing soda consumption.
Anybody else?
I had heard about a while ago where they were teaching the Latin community how to cook better, how to use the vegetables, and I think that is a real. Do you know if they're doing that in other communities and doing more of that, where people?
Yeah, so there was a question about efforts to teach different groups like Latinos to cook with fruits and vegetables that may not have been perhaps part of their traditional diet, but are readily available here in California. And I think SNAP, for example, does a lot of education with recipients around using fruits and vegetables, and my guess is that they try and target it, although I don't know specifically, but my guess is that they try to target it to different groups who may have different dietary patterns. So do you know more about that issue?
There are a number of organizations, I think, that have tried to increase fruit and vegetable consumption by teaching different ways to cook with fruits and vegetables. I know First Five has also sponsored some of those programs.
And do you know if they specifically targeted like different, I guess either different types of produce or different programs to different groups?
I'm not, I think it from what I know, generally it was about how to improve your diet. I don't know if it was cooking with specific types of fruits and vegetables.
Unless there are any other questions, I'm going to end it here. Thank you so much, Sue and Joelle.
Thank you.
Everyone, please stay subscribed for next month's seminar.